Good evening everyone. Today we will read Anacardium oriental, and this medicine is also known as Malacca bean, and it is also known as marking nut, and this medicine is belonging to the Anacardiaceae family. So how you will remember? Just you can remember by the name of Anacardium. If someone asked कि Anacardium is belonging to which family, then your answer must be Anacardiaceae, because it is very similar to the name of medicine. And this medicine is proved by Dr. Staff. And this medicine is belonging to the class 4. But which part of the anacardium is used in the preparation of medicine? Generally, seeds were using in the preparation of medicine. So let's talk about the symptoms of anacardium. Sudden loss of memory. Everything seems to be in a dream. Patient is greatly troubled about his forgetfulness. You can see in the picture the expression or reaction of the patient. If someone will forget anything, then his or her reaction will be like that. And the patient is thinking that it's going everything in a dream. And he is very anxious anxiety because of forget and fullness. But if you are talking about the sudden loss of memory, then we can correlate or compare with the another medicine. Like we can correlate or compare with the nux mosciata. So what is mentioned in nux mosciata? There is mentioned weakness and loss of memory. Means in case of nux mosciata, the patient will forget the well-known street where you guys are staying or where you guys are living. You will forget the well-known street. Like कोई मार्केट होगा फेमस या पॉपुलर, वो भी भूल जाएगा. अरे यार क्या था क्या नाम था, I forgot. That is a nux mosciata. But these symptoms again we can correlate or compare with the another medicine like syphilinum. But in case of syphilinum, there is a loss of memory, but there will be a problem with the arithmetical calculation. Means अगर syphilinum patient है, so उसको कह दो 2 + 5 कितना हुआ, he cannot calculate. 2 × 10 कितना हुआ, he cannot, because there is a problem with the arithmetical calculation. If any patient is coming to you and they cannot calculate, like market गया, सामान खरीदा उसने and 100 rupees आपने दिया and 50 का हुआ, उसको नहीं पता है कितना, आपने 30 दे दिया, वो रख लेगा, because he is having problem with a arithmetical calculation. That is a syphilinum. उसको calculation क्यों difficult होता है? Because here a point we can correlate with the organon of medicine with the myzome. A syphilinum is belonging to the syphilis myzome, and syphilis myzome is having the character of dull memory or dull mind. जिससे क्या बोलते हैं? बुद्धू. हिंदी में गबोधर बोलते हैं. गबोधर means he has no mind. Means उसके पास दिमाग ही नहीं है, मंद बुद्धि. That is a syphilinum, or that is a syphilitic patient according to the myzome. But these symptoms again we can correlate with the another medicine, that is medorinum. So what is mentioned in medorinum? In case of medorinum, there is mentioned constantly loses the thread of conversation. Means what I was teaching, I forgot. क्या बता रहा था? Can anyone tell? Just the patient will forget what he was talking, because there is mention constantly loses the thread of conversation. बात बोल रहा है लेकिन भूल गया, अरे यार क्या बता रहा था, क्या मेडिसिन की बात कर रहा था मैं, किस टॉपिक में बात कर रहा था? Because this is a symptom of medorinum, the patient will react like that. Okay, but we will talk about the another symptoms of anacardium, that is a sudden loss of memory, confused or unfit for the business. You can see in the picture, a patient is feeling a confused feeling, means he cannot decide what to do or what not to do. He is confused because our anacardium is having a two character, a two wheel. One is commanding to do, one is commanding to not to do. There is two wheel, and that's why the anacardium patient is confused. And if the patient is having problem with the memory, so he will be never fit for the business. जिसकी मेमोरी कमजोर होगी वो कैसे बिजनेस में फिट होगा, कभी नहीं फिट हो सकता है. Okay, another symptoms, so we will talk like lack of confidence in himself and others. Means anacardium patient क्या होता है, खुद में तो कमी होता है, यार I cannot do, I cannot study, I cannot crack the AIAPGET exam. बट वो कहेगा तुम भी नहीं कर पाओगे, जब मैं नहीं कर पाऊंगा तो तुम भी नहीं कर सकते. इफ आई कैन नॉट डू देन हाउ यू कैन डू, you will also not going to crack the exam. That is an anacardium patient. And disposed to be malicious and seems to on wickedness. The patient is always thinking, you can see in the picture, there is a, you lack a self-trust. A patient is having no trust because lack of confidence is there. And always comparing with the others, I cannot, then you cannot also. But these symptoms we can correlate with the lycopodium. So can anyone tell me the what is the symptom which is mentioned in lycopodium? Can anyone tell about the lycopodium? So there is mentioned, means a lycopodium is having lack of confidence, but once he will went on the dais or stage, then he will perform very nicely, which will be could not be expected. इतना अच्छा परफॉर्म करेगा कि हम लोग एक्सपेक्ट भी नहीं कर सकते. That is a lycopodium patient. And when walking in excess as if someone were pursuing him and suspects around everything around him. You can see in the picture. Means if any patient or any person is standing always suspecting, suspicious mind और किस medicine में होता है? Can anyone tell? If we will talk about the suspicious mind, very good. कौन सा pardon? Yes, lachesis mutus is there, and one more medicine is there, that is Hyoscyamus niger. Very good, Subhansa. Hyoscyamus is also there. The both patient are very suspicious. इतना suspicious होता है कि अगर तुम लोग suppose lachesis या Hyoscyamus patient आपके घर आ गया and you offered a sweet, so he will not eat. ओ मेरा पेट भरा हुआ है, अभी just घर से खा के आया, कुछ नहीं. He will be always diverting, and he will be always avoid to take all the offers what you offered. कुछ भी नहीं खाएगा, कुछ भी नहीं पिएगा, बस बहाने बनाएगा कि मैंने खा के आया. That is lachesis, and hyoscyamus, and another is anacardium oriental. And there will be a weakness of all the senses like light, touch, pressure, and smell. All the senses will be, there will be a weakness. But if there is a weakness of all the senses, like if weakness of smell is there, means no smell is there, so can anyone tell me the term what we will call as, क्या बोलेंगे अगर स्मेल नहीं आ रहा तो उस टर्म को क्या कहेंगे, what we will say? Yes, very good, अबे एनोस्मिया. बट अगर स्मेल काफी ज्यादा आ रहा हो तो क्या कहेंगे, what we will say? Very good, hyperosmia. Okay. Another symptoms, hypochondria with hemorrhoids and constipation. Hypochondria means a patient will tell you in the exaggerated form. But if you are talking about then hypochondriac, then again we can correlate with the organ of medicine. So can you tell me the name of number of aphorism? Aphorism number, can anyone tell? Very good. 96. In 96 there is a mention about a hypochondriac. There is mentioned by the Dr. Hahnemann, hypochondriac word. A patient will tell you in the exaggerated form. मिस थोड़ा सा चोट लगा है, ओ डॉक्टर साहब बहुत तेज चोट लगा, बहुत तेज. Means he will tell you in the exaggerated form to attract, to gain attention, कि मुझे पहले देख लो. अटेंशन गेन करने के लिए वो हाइपोकॉन्ड्रियक पेशेंट ऐसा रिएक्ट करता है. बट देयर इज मेंशन hemorrhoids and constipation will be there, means alternation will be there. Sometimes the patient is having constipation and sometimes there is a bleeding from the rectum, per rectum. But if you are talking about the hemorrhoids, so can you tell me the name of artery from there, the source of bleeding? Can anyone tell me the name of artery? हेमोरॉइड में किस आर्टरी से ब्लीडिंग होता है? No, rectal hemorrhoidal artery is there. Okay, from hemorrhoidal artery there is a hemorrhoids. Okay. Another symptom is strange temper, laugh at serious matter and serious over the laughable things. Means क्या होता है, बहुत ही विचित्र, कुछ लोग विचित्र होते हैं. Like okay, there are some people, if you are talking about funny things they will not laugh, but if you are talking about the serious matter they will be laughing. They will be always laughing. Like if we are teaching, if you are studying, the anacardium patient will laugh because we are teaching, this is a serious. But अगर कुछ जोक वाली बात होगी तो उस पे serious. That is an anacardium patient. So can anyone tell me the name of another medicine having the same symptom? Ignatia, very good. And one more medicine is there, that is Nux moschata. Okay. And the anacardium patient is thinks herself a demon, a curses and swear. उसको लगता है कि मैं ही हूँ जो हूँ. And अगर मैं कह दिया कुछ भी, if I will curse and swear, मैं कुछ भी अभिशाप दे दूं तो वो लग जाएगा किसी को. एनाकार्डियम पेशेंट क्या सोचता है कि मैं राक्षस हूं, मैं अगर कुछ कह दिया भला बुरा तो उसको हो जाएगा, कसम दे दिया तो भी लग जाएगा. He is always thinking like that. But this symptom we can correlate with another medicine, that is platina. Platina patient क्या सोचता है? I am superior, I am the boss. No one is superior than me. Everybody is inferior. I am the superior. That is the character of platina. Okay, but these symptoms again we can correlate with the another medicine where there is mention curse and swear. Can anyone tell me the name of medicine? Which medicine? Laccan and Laccan in the bracket and Lilium teak is there. Okay, in case of Lilium teak, there is mention disposed to think or often thinks. Okay, क्या and the patient will curse and swear. Always patient क्या होगा? अभिशाप देगा, जहां तू मर जाएगा, जहां तेरा एग्जाम ही पास नहीं होगा, क्लियर ही नहीं होगा एग्जाम. The patient will be always saying that is Lilium teak and Laccaninum is also there and Anacardium is also there. Another symptoms, headache relieved by entirely when eating. When the patient is eating, the patient feels much better. And when the patient is lying down in the bed, especially in the night, and when about falling asleep, when the patient is going to sleep, at that time the patient feels much better. But these symptoms we can correlate with the practice of medicine with the disease condition. So can anyone tell me the name of disease condition where we can correlate with these symptoms? Headache relief by entirely eating. Can anyone tell? Eating से किस किस डिजीज में आराम मिलता है? And bulimia nervosa and hey, pardon. Yes, in case of duodenal ulcer, you are right. वहाँ हंगर पेन रिलीफ होता है, बट वी कैन कोरिलेट ओके कि if there is any disease where the patient is getting relief by after eating, so we can think of duodenal ulcer. ओके हंगर पेन वहाँ रिलीफ होता है तो कोरिलेट कर सकते हैं हम लोग. बट if you are talking about headache, so we can correlate with the diabetes mellitus. Suppose if the patient is having hypoglycemia, so in this condition if the patient will eat, so the patient will get relief. Like hypoglycemia case में sometimes the patient is having headache, so the patient will be getting relief. But अगर hunger pain relief मिल रहा है, then the disease condition is duodenal ulcer. But अगर headache relief मिल रहा है, then we can correlate with the diabetes mellitus. And these symptoms again we can correlate with the materia medica. So can anyone tell me the name of medicine? और किस मेडिसिन से correlate कर सकते हैं? Sorinum, very good. And Sina, Sorinum, Carbovase and Avis nigra is also there. But these symptoms especially we can correlate with the Lycopodium clavatum. So what is mentioned in Lycopodium? There is mentioned headache and the patient is having craving for the food. If the patient will not eat, so there will be a headache. That is the symptoms of Lycopodium clavatum. क्या होता है उसको फूड बहुत फूड क्रेविंग होगा, खाएगा तो patient feels much better. But once the patient will not eat a food, so there will be a headache. That is the symptoms of Lycopodium. And these symptoms again we can correlate or compare with the another medicine, that is iodum. So iodum में क्या होता है? Iodum में patient is having craving for the food, but if he will be not eating, so there will be a acidity problem. that is iodine. Okay, another symptoms we will talk about, that is if to choke when eating and drinking. Means if the patient is eating or drinking anything, so there will be obstruction in the throat, so there will be a choking problem, and this choking we can correlate with the disease condition. Can anyone tell me the name of disease condition? Cafe coronary. This is belonging to the forensic medicine and toxicology. But can you tell me the disease condition? ओके, कैफो कोरोनरी क्या होता है? वो फॉरेंसिक में होता है, ठीक है, कुछ खाया बोलस अटक गया, दैट इज नोन एज कैफो कोरोनरी, ठीक है। बट डिजीज कंडीशन से क्या कोरिलेट करेंगे? प्रैक्टिस ऑफ मेडिसिन से। डिस्फेजिया, ओके, डिस्फेजिया इज द कंडीशन, पेनफुल स्वेलिंग ऑफ द फूड, तो क्या होगा? उसको प्रॉब्लम होगा, चोकिंग होगा, ओके। Another symptoms, gastric and nervous headache of a sedentary person. You can see in the picture, a patient is sitting on the sofa and having all the food and drinks. That is known as a sedentary life. And those people who are having a sedentary lifestyle, and if they are suffering from the gastric problem and headache, then we can think of this medicine, Anacardium. So can anyone tell me what are the medicine which is mentioned in the bracket? Can anyone tell? Very good. Nux vomica and Lobelia, and one more is there. Lobelia, Argentum nitricum. Very good. And yes, Bryannia alba is there. Bryannia alba is also there. Okay. But what is mentioned in Argentum nitricum? In case of Argentum nitricum, those people who are a literary work, those people who are working as a literary work or literary person is there, those who are working in the office, and if those person is suffering from the headache, so we can think of Argentum nitricum. And in case of Argentum nitricum, the patient is getting relief by tight bandaging. टाइट बैंडेज से आराम मिलता है अर्जेंटम नाइट्रिकम पेशेंट को हेडेक के केस में. So in that condition we can think of Argentum nitricum. But when we will think of agaricus, in case of agaricus, those people who are debauchers, those people who are drinking alcohol or wine, and if they are suffering from the headache, then we can think of agaricus. Okay. Another symptoms, swell is food and drink hastily. Means what the patient is eating or drinking, he will be drinking oily too quickly and too fast.
It's nice. You want to add something?
And the symptom disappear while eating.
Living the dream. Living.
So symptom disappear while eating. If there is a problem in the throat, but the patient is getting relief by eating. Another symptom, sensation as if a hoop or band around the part, as of a dull or bluntish to meat, pressing as of a plug in the inner parts. Means there is a sensation. Two type of sensation is there. One is sensation is plugged up sensation, especially in case of a digestion. Especially in the rectum, in the intestine, we will find a plugged up sensation. But we will find in case of headache, we will find a band or loop around the head. There are so many medicines for the same symptom, like sulfur is there, gelsemium is there, and carbolic acid is also there. 3 medicine is there. If there is a sensation of band or loop around the head, 3 medicine sulfur, carbolic acid is there. Okay. Another symptoms, warts on the palm of hands. You can see if you are finding warts on the palm of hands, so we can think of anacardium. But can anyone tell me the another medicine? In case of if you say what? Yes, natramur is the right answer. Natramur, very good. But if someone say डलका मारा, when we will think of डलका मारा के बारे में कब हम लोग सोचेंगे? If there is a words on the dorsum of hand, means back of hands के बाद, means ये front में हो रहा है, palm पे हो रहा है, but back of hands पे होगा या dorsum of hand, so we can think of डलका मारा. But if there is a words, flat words which is very sore to touch, then the medicine is natrum carb. Okay. Another symptoms are prone to go from right to left. Means if you are talking about the anacardium, always the patient is having complaint with the right side and always moving to the left side like lycopodium. But these symptoms we can correlate with the another medicine like lachesis. Why we will compare with the lachesis? Because in case of lachesis there is affection and involvement especially on the left side, like lilium twig is also there and thuja is also there for the left sided medicine, and there is a intermittency of symptoms, means always if the patient is having any symptoms, it is intermittency of symptoms will be there, means sometimes another symptoms will be there, and the anacardium patient does not want to work, means any work, either business, either study, either work, he will be not doing because aversion to work is there. But if you are talking about aversion to work, so we can compare or correlate with the another medicine, that is Bacteria tinctoria. So in case of Bacteria there is mentioned aversion to work and the patient is inability to think about the work or do, that is mentioned in Bacteria. And another symptoms, it is skin symptom. Its skin symptoms are very similar to the rust ox, and it has proved a valuable antidote to the poison oak. Means kya? Means if you are talking about the skin symptoms of rust ox and anacardium, both are the same. But suppose if you prescribe to someone a rust ox and the patient is having aggravation, but we can prescribe anacardium to antidote the rust ox. But rust ox is also the medicine, it will be antidote by the same medicine. रस्ट ऑक्स ऐसा मेडिसिन है जो खुद के पोटेंसी से ही एंटीडोट हो जाता है. लाइक सपोज इफ यू हैव प्रेस्क्राइब 1 m, if you will prescribe higher potency 10 m, then it will antidote the own action. This is mentioned in the Allen keynote and under the रस्टॉक्स. ओके, रस्टॉक्स एक ऐसा मेडिसिन है जिसको खुद अपने ही पोटेंसी से एंटीडोट हो जाता है. ओके. Another symptoms, fear of examination in the student. You can see in the picture, the exam is coming. The patient is having so much fear. The student is having so much fear. How we will pass? What the question? What are the question will be there? I haven't read this question. There are so many things. If we are getting this type of symptoms, then we can think of anacardium. So can anyone tell me the more medicine about the examination funk? Athuja, very good. Mani, very good. And argentum nitricum, yes. Gelsemium, very good. Soumya, gelsemium and anacardium, 4 medicine is there. Okay. सेशन एंड होने वाले हैं आफ्टर 4 मिनट्स, अगेन क्विकली ज्वाइन करना है, ठीक है, रिमेंबर. ओके, another symptoms suspicious. We have already talked about suspicious. If you're talking about the suspicious mind, then there are medicine like apis is there, hyoscyamus and lycosis is also there. Another symptoms clairaudient, hears voice far away. Okay, so I was talking about clairaudient, hear voices far away or of the dead. Means an anacardium patient is always listening a voice from a distance. Those people who have already dead, उनको लगता है कि मरे हुए लोगों का काफी आवाज आ रहा है दूर दूर से ऐसे, which is not audible to the patient, but the patient is always feeling like that कि आवाजें आ रही हैं मरे हुए लोगों की ऐसे ऐसे काफी दूर से. The patient will tell you like that, okay, and there is absence of all the moral restraint and coryza with the palpitation, especially in the age. Means if the patient is having heart problem, so it is associated with the coryza and especially old people, and a cough which is excited by the talking. Means if the someone is talking, so the means suppose I am teaching, at that time the patient is having cough while talking against the cough, and especially in a children after a fit or temper, अगर थोड़ा सा गुस्सा भी आ गया कुछ भी हो गया, so there will be a cough. But if there is a cough after talking, so there are so many medicine, stanum metalcum, phosphoric acid and phosphorus is there, and argentum metalcum is also there. Okay, another symptoms, finger swelling with vesicular eruption. You can see in the picture, if you are getting this type of eruption especially in the fingers, then we can think of this medicine, especially anacardium. Another medicine we will read, that is anthracinum. Anthracinum is a medicine which is also known as a nozote, and this medicine is prepared from the anthrax poison from the cattle, and this medicine is proved by Dr. Staff. So let's talk about the anthracinum. In carbuncle, malignant ulcer and complaints with the ulceration and sloughing and intolerable burning is there. Means if you are talking about the carbuncle, so can anyone tell me the meaning of carbuncle? What is carbuncle? Can anyone tell? Yes, very good. Yes, very good. Miss cluster of boil. Miss कहते हैं ना, अगर बहुत सारे 5-6 अगर boils हो, that is known as a carbuncle. And can anyone tell me the causative organism? Name of causative organism? Can anyone tell? Yes, very good. Staphylococcus aureus. Okay. And there will be a malignant ulcer and complaints with the ulceration and sloughing. Means if the patient is having carbuncle or boils, so there will be a sloughing. Sloughing means there is a layer of dead skin. But if there is a layer of dead skin, so there will be a intolerable burning. A patient cannot tolerate. But if you are talking about the carbuncles, so we can talk about the furuncle, that is known as boil. Okay. Another symptoms, when arsenic or the base selected rheumatic fails to relieve the burning pain of carbuncle or malignant ulceration. Means suppose if the patient is coming to you and he is having burning pain, especially the patient is having carbuncle or malignant ulcer, and you have prescribed arsenic, the medicine is not working, then we can think of this medicine. Anthracinum. Another symptoms, blood oozes from the mouth, nose, anus or sexual organ. Black or thick tar-like, rapidly decomposing. Means this is the characteristic symptoms. Means if you're finding blood character, so we will find a thick tar-like. टार लाइक का मतलब क्या होता है? सड़क पे जो पीच रोड बनती है, पीच होते हैं को तारकोल जिसे हम लोग कहते हैं, उस टाइप का अगर डिस्चार्ज होगा, देन वी कैन थिंक ऑफ दिस मेडिसिन दैट इज एंथ्रासिनम. Another symptoms, gangrenous ulcer, swollen, carbuncle, erysipelas of malignant type. You can see in the picture, a patient is having gangrenous ulcer in the foot. So if you are talking about the gangrenous ulcer, so we can correlate with the pathology. If you are talking about the pathology, there are two types of gangrene is there. One is dry gangrene, one is wet gangrene. So can anyone tell me the meaning of dry gangrene? What is dry gangrene? What is dry gangrene? Dry gangrene means, yes, this is the difference. But in case of dry gangrene, there will be a problem with the arterioles, means there will be a problem with the circulation. Okay, there will be no proper supply of the blood. Suppose if you are talking about the dry gangrene, so we will find in case of dry gangrene, we will find there is a line of demarcation. But if we will talk about the disease condition, then we can correlate with the diabetes mellitus. Diabetes mellitus is a condition where we will find a dry gangrene. Atherosclerotic is there, another disease condition. In two disease condition, we will find a dry gangrene. But if you are talking about the wet gangrene, so there is a formation of the causative organism. So can anyone tell me the causative organism of wet gangrene? causative organism का कोई नाम बताए? Very good. Clostridium welsi is the causative organism of the wet gangrene. Very good. Another symptom, swollen, the worst case with the sloughing and terrible burning pain. You can see if you're finding at the tip of finger, if you are there is a bumps which is tender and which is having a burning intolerable pain, then we can think of this medicine that is Anthracinum. But if there is a dyspareunia at the side of finger, especially at the tip of finger, then we can think of another medicine that is Diascoria, Hipposulf and Thuja is also there. Okay. Another symptoms, carbuncle with the horrible burning pain, discharge of ichorous offensive pus. Means if the patient is having carbuncle, so there will be a discharge which is very ichorous and offensive. Why? Because there is a formation of the bacteria that is Staphylococcus cocci aureus, Staphylo aureus. Okay, and there will be a burning pain which is intolerable. Means terrible burning pain will be there, and there is a bad effects from the inhaling foul odors, and there will be a black and blue blister will be there. Means if there is a eruption, so it will looks like a black or blue in color. But if you are talking about the black or blue blisters, then we can correlate or compare with the another medicine. ब्लैक वेसाइकल और किस मेडिसिन में होता है? ब्लैक ब्लिस्टर या ब्लैक वेसाइकल और किस मेडिसिन में होता है? Black vesicle. This is also mentioned in arsenic album. Okay, not graphitis, arsenic album. But yellow vesicle किस में होते हैं? Yellow blister या yellow vesicle? In case of there is a discharge, okay, yellow discharge is there, which is also mentioned in pulsatilla. But if you are talking about a yellow vesicle, then the medicine is rustoxicodendron. But if you are talking about the yellow vesicle, then we can talk about the blue vesicle. So can anyone tell me the name of medicine where there is mentioned blue vesicle? No, if you are saying ambragracia, in case of ambragracia, there is mentioned blue is leucorrhea is there. Bluish color of leucorrhea is there, that is ambragracia, causticum, muxol, nitric acid. But I am asking blue vesicle where it is mentioned, under which medicine? Can anyone tell? That is not like that is ranunculus bulbosus. Okay. Another medicine we will read, that is antimonium crudum. Okay, if you are talking about antimonium crudum, so this is known as black sulfide of antimony, and this medicine is proved by Dr. Carl W. Caspary. But if you are talking about the Caspary, so can anyone tell me where we have read a Caspary? Caspary और कहाँ पढ़े हम लोग? Can anyone tell? Who has given pharmacopoeia? Who has given pharmacopoeia? Yes, very good. Can you tell me the year? In which year? Yes, very good. Excellent, Pritika. That is a Carl W. Caspary, okay, which is published in the 1825. That is a pharmacopoeia. But if you are talking about the pharmacopoeia, so can anyone tell me the year where the SPI is published? In which year? Can you tell me the year? Oh. Yes, very good, excellent, Kritika, very good. Okay, come back to the antimonium crudum. Okay, let's talk about the symptoms of antim crude. For children and young people inclined to grow fat for the extremes of life, you can see the picture. If extremes of life means what? Means whether the patient is younger, too young child is there, or too old person will be there. That is the meaning of extremes of life, and they are having too much growing fat. You can see in the picture there will be so much deposition of fat around the abdomen. Okay, if you are finding this type of symptom, then we can think of antim crude. Okay, another symptoms, if old patient is there, then there will be having a morning diarrhea. Means having diarrhea especially in the morning time. But if you are talking about the morning diarrhea, then we can talk about the another medicine, that is Aloesocratina, and nitric acid is also there. Okay, and the patient become suddenly constipated. Means sometimes the patient is having constipation and sometimes the patient is having diarrhea. But at that time there will be a pulse hard and rapid. Means there will be a quick pulse. Frequent pulse will be there. But if you are talking about the alternate constipation and diarrhea, these symptoms again we can correlate with the organon of medicine. So can anyone tell me the aphorism number where it is mentioned alternating action? That is 115. Okay. But if you are talking about the alternating action, so we can talk about the alternating disease. So can anyone tell me where it is mentioned alternating disease? In which aphorism? In organon of medicine? We will say that is 231, 232. 232 is there where there is mentioned alternating diseases. Okay. But if you are talking about alternate constipation and diarrhea, then we can talk about the another medicine. So can anyone tell me the more medicine about alternate constipation and diarrhea? Very good. Abrotinum and Abrotinum and very good. And Abrotinum, Nux vomica, and sulfur is also there. Podophyllum peltatum is also there. Okay, but if there is a symptoms rheumatism alternate with dysentery, then the medicine is Calibi. Okay, another symptoms child is fretful, peevish, means a very irritable child is there, cannot bear to be touched or look at, or sulky, does not. In case of aphorism 251, there is mentioned examples of alternating action. What are the medicine? There is a belladonna, bryonia, rustox, ignacia. 4 medicine is mentioned. But if I have been asked alternating action, then your answer must be 115, 115. But alternating action के examples की अगर बात की जाए तो 251 के एफोरिज्म में मेंशन है जहां पे 4 मेडिसिन है, बेलाडोना, ब्रायनिया, रस्टॉक्स एंड इग्नेसिया. ओके, yes, very good. There are 4 medicine. Okay, again come back to the anti-crude. Okay, child is fretful, peevish, cannot bear to be touched or look at, sulky, does not wish to speak or spoken to, angry at every little attention. Miss बहुत इरिटेबल पेशेंट होता है. मिस अगर इसको छू दो ना दिन में आ जाएंगे. मिस द पेशेंट विल से एंड ही डज नॉट वांट कि मुझसे बात करो, या नहीं बात करना चाहता है, नहीं कोई इससे बात करे, नहीं वो उससे बात करे, किसी से वो बात नहीं करना चाहता है. Okay, but these symptoms we can correlate or compare with the another medicine, that is Antim tart. Antim tart, child is very irritable. उसका अगर पल्स भी चेक करने जाओ तो वो चेक नहीं करने चाहेगा, लेकिन चाइल्ड क्लिंग्स those around him and want to be carried, but if you will touch, the patient will be weaning and does not want to touch him and will not let you feel the pulse. सुने नहीं देगा, अगर पल्स सोचो चेक कर लो तो नहीं, लेकिन अपने मन से क्या होगा, अगर आप उसके अराउंड खड़े हो तो तुम्हारे ऊपर चढ़ जाएगा, गोद में उठाओ, गोद में उठाओ, लेकिन खुद से अगर उठाने जाओगे तो वो उठाने नहीं देगा. दैट इज एंटिम टार्ट पेशेंट. ओके, another symptoms great sadness with weeping. You can see the picture, and patient is having so much sadness, and the patient is anxious and depression and melancholy patient is there, and the patient is crying. But these symptoms again we can correlate with the another medicine, that is ambragracia. So what is mentioned in ambragracia? There is mentioned great sadness and 6 days for weeping. The line has been mentioned, great sadness, 6 days for weeping. You have to remember the line because line पूछी जाएंगी एग्जाम में, ठीक है. तो अगर आया line great sadness and 6 days for weeping, there your answer must be ambragracia, not antiprode, not sepia. But अगर great sadness with weeping आ रहा है, then your answer must be antiprode. But if there is a question great sadness and weeping, then your answer must be sepia of Snellis. Very good, excellent. Another symptoms loathing life. Loathing life का मतलब क्या होगा, जिंदगी से बोर हो गया हुआ, उग गया है, means he got bored from the life, and the patient is always irresistible desire to rhyme, talk in rhymes and repeat verses. means क्या होगा जब बात करेगा, ओ कैसे हो, means ऐसे बात करेगा जैसे वो गाना गा रहा है, और खाना खा लिया और मजे आ रहे हैं. means if he will be talking, he will be always talking with the rhymes. Okay, and he is very sentimental patient. melancholy patient. Okay. Another symptoms, suicide by drowning. Okay. If you are talking about the suicide by drowning, so we can correlate with the forensic medicine and toxicology. Like you have read a drowning. So if you are talking about the drowning, so what we will find, क्या मिलेगा जिसको हम कहेंगे कि ये ड्राउनिंग का केस है? कैन एनीवन टेल? क्या फाइंडिंग मिलती है ड्राउनिंग में? यस, वेरी गुड, डायटम्स. ओके, डायटम्स मिलेंगे. एंड ड्राउनिंग के केस में और क्या मिलेगा? देयर विल बी अ ग्रास एंड वीड इन द फिंगर्स, इन द हैंड. क्या होता है? कैडावरिक स्पैजम हो जाता है. व्हेन द पेशेंट इज ट्राइंग टू कम अप विथ द वाटर, ऊपर आने की कोशिश करता है तो क्या होता है? जमीन पे जो भी चीज मिलेगा हाथ से पकड़ के ऊपर आना चाहेगा तो उसके हाथ में क्या मिलेगा? ग्रास एंड वीड मिलेगा. ये भी फाइंडिंग. बट अगर डायटम्स की बात कर रहे हैं, सो उसके ट्रैकिया पे जो भी मिलते हैं सैंड पार्टिकल, तो कौन सा ग्लास यूज किया जाता है टू डिटेक्ट द डायटम्स? क्या ग्लास यूज किया जाता है? उसका नाम क्या होता है? क्वेश्चन आता है ये. दैट इज मुखर्जी ग्लास टेस्ट. ओके. बट इफ यू आर टॉकिंग अबाउट द सुसाइड बाय ड्राउनिंग, सो ड्रीम ऑफ स्विमिंग किस मेडिसिन में मेंशन है? ड्रीम ऑफ स्विमिंग, that is mentioned in Rustox. Okay, but if you are talking about the suicide, so again we can correlate with another medicine, that is Nux vomica. Nux vomica patient want to commit suicide but has no courage to suicide. सुसाइड करना चाहता है बट हिम्मत ही नहीं है कि सुसाइड कर ले. सोचता है कि छत से कूद कर जान दे दूं, बट हिम्मत ही नहीं है कि कूद जाऊं. That is Nux vomica. Okay. Another symptoms, headache after river bathing, from from taking cold alcoholic drinks and deranged digestion, acid, fat, food or suppressed eruption. कोई तालाब में नहा लिया उसको हेडेक हो गया, कोई दारू पी लिया उसके बाद हेडेक हो गया. एंड अगर किसी को स्किन इरप्शन है एंड द पेशेंट हैज टेकन एनी एलोपैथिक मेडिसिन and there is a suppression of skin eruption, so the patient is having headache, so we can think of Antim Crude. But if there is a diarrhea after suppression of skin eruption, then the medicine is Graphitis and Apis mellifica is there. Another symptoms, a thick milky white coating on the tongue. You can see in the picture. If you are getting this type of symptoms, then we can think of Antim Crude. And this condition we can correlate with the practice of medicine, the disease condition, that is leukoplakia. Leukoplakia generally क्या होता है? Malignant condition होता है. Okay. Another symptoms, gastric complaints from overeating, stomach weak or digestion easily disturbed. Means those people who are taking too much food and there will be a weakness of the digestion and a patient cannot digest. So again we can think of this medicine. And where is subject to canker or soreness in the mouth, means if the patient is coming to you, then he will be having a aphthous or ulcer into the mouth, which is very painful. But if there is a aphthous in the mouth and there is profuse salivation, then the medicine is Maxol. Aphthous ulcer के साथ अगर profuse salivation है, then we can think of the medicine is Maxol. Okay. Another symptoms, longing for the acid and pickles. But if you are talking about the longing for the acid and pickles, then the another medicine is, can anyone tell me the medicine? कौन सी medicine है और where there is mention longing for the pickles or acid? that is HEPA. Okay. Another symptoms, gastric and intestinal affection from the bread and pastry, acid, especially vinegar, sour or bad wine after cold bathing, overheating or hot weather. Means especially those people who are taking the pastries, cake or anything and which is causing indigestion to the patient, especially in hot weather or summer hot weather, then we can think of Antim Crude. But if there is a problem from the hot, means drinking of cold, means cold drink, if the patient is having cold drink especially in the summer hot weather, then the medicine is brania. अगर कोल्ड ड्रिंक पीने के बाद या ठंडा पानी पीने के बाद अगर कोई भी कंप्लेन हो रहा है स्पेशली इन समर सीजन लाइक दिस सीजन, so we can think of brania. Okay. Another symptoms, large horny cones on the soles of feet, which is very sensitive when walking, especially on the stones or pavements. क्या होता है, कौन अगर किसी को हो गया which is very sensitive to touch, if the patient is walking on the hard surface, then we can think of antincrude. Another medicine is ranunculus bulbosus, in the bracket salicylic acid is there, and there will be a loss of voice from becoming overheated. Another symptoms, disposition to abnormal growth of the skin. Fingernails do not grow rapidly. Crushed nails grow in splits in warts with the horny spots. You can see there will be a growth, especially a abnormal growth. But if the mostly patient is coming, if they are having problem, especially we can correlate with the disease condition like tinea anguinum is there, means फंगल ऑफ द नेल, तो उसमें क्या होता है, स्किन लोग नेल ग्रो नहीं कर पाता है, मीन्स देयर विल बी अ नो ग्रोथ ऑफ द नेल. That condition is known as tinea anguinum. In this condition, we can think of antim-crude. But if you're talking about the warts, so what type of warts will we find? There will be a horny spots type of warts will be there. Okay, you can see in the picture. But if you are talking about the flat wart, then the medicine is Dalkamara and Thuja is there. Another symptoms, all the condition are aggravated by the heat and cold. Means whatever the complaint, generally it will be aggravated by the heat and cold. Then we can think of antincrude, and most important thing, the condition, an absence of pain where it could be expected is noticeable. Like here we can correlate with the practice, we can correlate with the pathology. Like boils होता है, someone is having boils, तो boils में क्या होता है, पेन भी होता है, इन्फ्लामेशन भी होता है, रेडनेस भी होता है, हीट भी होता है. But it must be there, pain must be there in case of boil. But if there is absence of pain, so we can think of antim-crude. It must be there, but it is absence of pain is there, which was expected to be present. And antim-crude patient is having great loss of hair with headache. A patient is having headache and there will be a loss of hair. Then again we can think of antim-crude. And there will be a gouty metastasis will be there, and which is metastasis to the stomach and bowel. Another symptoms, atrophy of penis and testicle will be there. But these symptoms we can correlate with the another medicine. If the patient is coming to you and the patient is saying that, Doctor Saab, मुझे ऐसा लगता है कि my penis is absent. Sensation as if penis were absent. Can you tell me the name of medicine? कौन सी medicine है? Patient को लगता है उसका penis ही absent है. Can anyone tell? That is cocaine. Okay, cocaine is the medicine. Another symptoms, eczema with gastric derangement. Suppose if there is a gastric derangement or the patient is having eczema. Eczema के साथ अगर पेट में गड़बड़ी हो, so we can think of Antim crude. Okay, and there will be a continual drowsiness, especially in the old people. But if you are talking about the drowsiness, then again we can talk about gelsemium. So in case of the gelsemium, we will find a 3D. So can anyone tell me the 3D of gelsemium? Very good, Ria. Dullness, dizziness, drowsiness. Very good. Okay. Another symptoms, mucus piles, continued oozing from the mucus. Mucus piles means if there is a discharge of blood which is associated or which is mixed with the mucus, and if you are finding mucus piles, then again we can correlate or with the disease condition like dysentery is there. In case of dysentery, if there will be a passing of stool which is mixed with the blood and mixed with the mucus, then we can think of antimcrode, and another medicine is Maxol. So when we will think of Maxol, Maxol कब prescribe करेंगे? पेट में ऐंठन होगा, means there will be a pain and suddenly there will be urging for the stool. The medicine is Maxol. That condition is known as tenesmus. Okay. Another symptoms, eruption on the scrotum and about the genitalia or genitals. If you are finding this type of eruption, especially on the scrotum or genitals, so we can think of this medicine. Okay, thank you everyone. If there is any doubt, you can ask me.